43-year-old man with a history of untreated HIV presents with fever, shortness of breath, and a non-productive cough for the past week. Past medical history is significant for HIV, diagnosed 10 years ago and never treated. His most recent CD4 cell count was 105. Physical exam reveals bilateral crepitus over all lobes. No lymphadenopathy. Chest X-ray shows bilateral infiltrates. Which of the following is the best treatment for this patient? So identify the organism, and then your treatment will become very easy. Is it a heart? Is it TMP-SMX, ganciclovir, azithromycin, or amphotericin B? So this patient most likely has PCP pneumonia, an opportunistic infection caused by pneumocystis jirovecii, common in AIDS patients, usually those with a CD4 count of less than 200. And that is why all HIV patients with a CD4 count of less than 200 receive prophylactic therapy with TMP-SMX, which is also used to treat the active infection. Now, heart, it is specific therapy for HIV, but it should not be started in a patient who has an acute infection, because it can exacerbate the infection by causing something known as immune reconstitution inflammatory syndrome. So when we give the heart therapy, the lymphocyte count is going to elevate and try and come back to normal. And that is what is responsible for causing this overactivation of our immune system. So once we finish giving the therapy for PCP, that is when we institute heart. So in AIDS patients with PCP, heart is typically started after 4 to 6 weeks of treatment with TMP-SMX. Ganciclovir for CMV pneumonia. Okay, so ganciclovir is used for the treatment of cytomegalovirus pneumonia. Azithro for the prevention and treatment of Mycobacterium avium complex. It's found in HIV patients with a CD4 count of less than 50. So this is something you can remember. We usually don't give it as prophylaxis anymore, because they believe that because of early institution of treatment nowadays, patients don't really go to the stage where the CD4 count drops to less than 50. But yes, it is used in the treatment. Amphotericin B is used for the treatment of severe fungal infections and also cryptococcal meningitis along with flucytosine. Okay, so this is something, I don't remember if we've gone over this in the past, but something you need to know, that for the treatment of cryptococcal meningitis, we use a combination of amphotericin B along with flucytosine.
Thanks for watching. Please give a thumbs up and subscribe for more.